Healthy Rebel Radio is sponsored by the Healthy Rebel app. 300 plus secretly healthy, delicious, mouth-watering dessert and treat recipes made with all-natural, whole food ingredients. Now available for download on the App Store and Google Play. Find out more details at healthyrebel.com.
Welcome to Healthy Rebel Radio. I'm your host, Dr. David Deiser. I'm here with my Dami Health Healthy Rebel co-founder, Amy Lane. Good morning.
Good morning.
Let's get right to the news. The first thing we're talking about today is back pain, specifically low back pain. As she rolls her eyes at me, because really that's been my major issue since university basketball has been back pain. Mm-hmm. That's what I've been dealing with, and it's funny because it's become a huge part of my practice.
Really?
Yeah, and it's sort of the things you go through, I find with my colleagues, is that's what tends to come up in your practice. Mm. So, obviously, I'm really interested in the research around back pain, and there's a major study coming out today, over the course of the weekend, about low back pain. It was published in JAMA Internal Medicine, and it's all about what is the most effective modality for treating low back pain. So it's a review of over 6,000 studies. Mm-hmm. They found that there was 23 studies that were really, really well done, and it encompassed 30,000 people. So out of these 30,000 people, the most effective thing for treating back pain, above all else, exercise.
Wow.
Yeah, above all else. So exercise is shown to reduce episodes of low back pain by 45%.
Did it say what type?
Well, here's the interesting thing. It doesn't matter. It did not matter what type.
So what do we think?
So we're talking about routine exercise, weights, cardio, walking, stretching. It didn't matter.
So not living a sedentary lifestyle.
Exactly.
Wow.
Yeah.
So a body of motion stays in motion.
There you go. Love that. So, it's true for me. I notice that when, you sit too much during the day or don't get up every hour or, your back pain flares up, and you see all the time with patients.
Yeah.
It's so incredibly prevalent. The importance of exercise for so many things. It doesn't even matter what you're talking about. Exercise is beneficial.
I know. Isn't it crazy?
There is a limit.
Definitely. Well, and that's the thing, if someone's having low back pain, they probably shouldn't go out and join a CrossFit group, mm-hmm. Or focus on, deadlifts or all those different things. Like, there should be a disclaimer there.
Yeah.
As to
not at first.
Right.
Right.
What you should be focused on. So, how do you explain to people that have back pain, that are in pain, mm-hmm. that then they should get up and move? That's a hard cycle to break.
Well, it can be, but really the first question is, when does it feel better? And when does it feel worse? And low back pain is normally worse in the morning and gets better throughout the course of the day. They say, it's better when I'm not sitting a lot. Or it's better when I'm walking. I don't notice it. Well, okay, so here's the next step. If you build your core, if you do some strengthening around your abdominals and your lower back muscles, mm-hmm. your glutes and quads, it's going to get better and better and better.
Right. And a great, a lot of people, when they hear strengthen your core, they right away think get on the floor and do sit-ups. But, I've seen the best results with strengthening core by, focusing on holding your abs tight. Everything that you do, like during the day, like even sitting here right now, draw attention to it, pull it into your spine. Mm-hmm. Sitting up straight, walking straight, everything you do. But then things that you don't expect to be amazing for abs, things like sprints.
Oh, yeah, very good.
It's like the best
sure.
ab workout. Mm-hmm. You hold your abs tight. It's also great for glutes. Mm-hmm. Hiking is amazing for your abs as long as you're like standing straight and holding. You can make anything basically an ab workout.
Oh, for sure. Because when you're doing sprints and when you're doing hiking, both of these things require that knee drive. So when you pick your knee up fast or when you pick your knee up to go up a mountain, you're working your hip flexors.
Right.
Which are abdominal, which they're core muscles. They go from the quad, for example, crosses the hip joint.
Right.
And the hip flexors, iliopsoas, crosses the hip joint. It starts on the femur and goes to the low back.
Wow.
So when you cross your legs, when you're seated, one hip flexor is lengthened and one is shortened, and it pulls on the spine. So posture while you're seated is important as well. Mm-hmm. But it's like you said, pulling those abs in.
Mm-hmm. And sitting up straight.
Oh, it's one of the best things you can be doing.
It changes everything. Posture, and it takes practice. It's one of those things that you have to kind of check in with yourself, at first every few minutes, then, eventually every hour, and then just, like, once in a while you notice, like, oh, wait, I'm slouching today.
Mm-hmm.
And something you did for me, posture-wise, which really helped me out, was you adjusted my seat and my computer and my table.
Mm-hmm. Yeah, the ergonomics of things are so important. You want your elbows and knees to be at 90-degree angles.
Yeah, and that really changed things for me, because remember I was having the in between the shoulder.
Mm-hmm.
Yeah.
Yeah, it's important. And I think this is also applicable for upper back pain. Mm-hmm. Because when you talk about upper back pain, and this is something I've been through, is it's so much about posture while you're sedentary. Mm-hmm. So while you're seated, if your shoulders are rolled forward, mm-hmm. the rhomboid muscles are lengthened and they become exhausted and they become painful.
Right.
And the body starts to send scar tissue and you get knots in the muscle. It's the same thing with sleeping. So often I see people with upper back pain and they sleep on their side.
Yeah.
They don't, and they have the one shoulder rolled over.
Right. So
in that case, that muscle is being lengthened all night long, and you have to hug a pillow to keep it back. It's the same thing with low back pain and sleeping on your side, because if you're someone who sleeps on your side, you know that when you get comfy, one knee is completely rolled over and flexed and really high. So that hip joint is really gapped on that side, and then the muscles and ligaments are both stretched.
Right.
And the other side is really shortened.
But it's tricky, because didn't we learn for brain draining that we want to sleep on our sides?
Yes, exactly. That was important.
See?
There you go. Huh? So what you want to do is make sure you have a good straight spine.
Right.
And often that will require a body pillow.
So you're for a body pillow?
I'm for a pillow, but if you sleep on your side, I'm for a pillow between the knees and a pillow that you hug onto. Because it keeps the shoulders back, and the one between the knees keeps the hips in line. Yeah, I'm all for it.
What if you have a dog that's
a major issue.
That sleeps partially, like if you're on your back, will sleep physically on your chest. Mm-hmm. Or if you're on your side, will sleep partially on your back and your neck. In your head? What do you do about that?
Well, I have some recommendations for that, but I don't know that they're applicable.
Yeah.
Yeah, you've got a real situation there, haven't you? Mm-hmm. With one dog sleeping on your stomach and one dog sleeping on your neck?
Yes, I am officially a dog pack.
Oh, yeah. But definitely.
It's like, sometimes I wake up and my neck is so sore, but it's so, like, much love that I can't end it. Mm-hmm. I'm in a real situation.
Mm-hmm. What did your mother say yesterday?
She said, the dogs are almost 8, and she said, it's a real shame you never train those dogs to sleep in their own bed.
It's a real shame.
Yeah.
Oh, so funny.
Too far gone now.
Yeah, much too far gone. And so don't recommend that for back pain.
No. But that's exciting about back pain, because I know it's a chronic problem that, that can be very emotional.
It can be, definitely. And it makes, in that emotion, it makes you want to be more sedentary. It makes you want to just relax and sit on the couch or lay down, and what happens is the muscles become weaker. The ligaments don't get activated, the tendons aren't being strengthened, and eventually it just gets worse and worse and worse.
So we're saying move,
get the blood flow going. Okay, study number 2, looking at proton pump inhibitors, which are drugs used in acid reflux.
Okay.
So they're one of the most prescribed drugs on the market. I see, oh my gosh, 20% of my patients are on some form of acid blocker. You'd be surprised.
For what?
For acid reflux. Heartburn.
No way.
Yeah. Heartburn. It's just crazy.
So it's not severe that they go and they get medicated for it?
Definitely. You'd be
really?
surprised. Oh my gosh, yes. Thousands and thousands of people. It's one of the most prescribed drugs in North America will be H2 blockers is one type, and then there's this other type called proton pump inhibitors, PPIs. They're extremely popular, and the recommendations on the commercials and on the prescriptions are to only do them for short periods of time, no longer than 2 weeks.
Short-term solution?
Yes.
Okay.
But people take them all the time if they have a big meal. Like, for example, the person in the commercial in the States is Larry the Cable Guy.
Ah.
And he's talking about how you can have, your chicken wings, and then you can go and lay down and take one of these and you can be all good.
Basically, it's saying you can binge eat and pop one of these and you'll be fine.
Exactly. And I know people who have acid blockers just in their cupboard from the over-the-counter ones that they just have on hand because it's something they do as a routine.
So why are these people, what are reasons that heartburn is caused?
Well, heartburn is when you have a reflux of acid that goes up the esophagus.
Okay.
So that's either because there's too much acid being released, or there's not a negative feedback telling that sphincter to close.
Okay.
Right? So it happens when you have really big, heavy meals normally. Okay. And one theory is that tons and tons of acid is released, and it just makes its way past that, past the sphincter.
Okay.
And it starts to burn in the chest, and you burp and all these things.
So eating too much.
Eating too much high-protein foods normally.
Okay.
Now, there's other theories out there that it's low acid. This is where it becomes tricky in naturopathic medicine, and we do a few different tests to figure out what the cause is, and we just don't blanket the treatment with, oh, you have high acid, here's what you should do.
Mm-hmm.
You have to figure it out if it's this low acid situation. The low acid situation is you have a really heavy meal, but you don't necessarily eat a lot of meat, and you don't have a lot of acid production, so you don't have the feedback telling the sphincter to close.
Okay.
It's usually acid that tells it to close. So the sphincter stays open, and whatever acid is in there comes up. And that happens. You'd be surprised. We do this thing called an HCl challenge, where we give a person stomach acid, and in a lot of cases, it's effective. Now, don't try this at home without speaking to your physician about it, because it can be dangerous if you have high acid.
Okay, so one way to prevent having heartburn could be making better food choices.
That's the main way. Don't eat. Yeah.
What you're describing about what I picture is like a little valve that opens and shuts.
That's exactly.
Laying down
Mm-hmm.
after a meal seems like a terrible idea.
Mm-hmm. So they recommend that people lay down on an angle with their head up.
Or just not eat for a few hours before.
Exactly.
Like we suggest.
Yeah, and there's a few foods that cause it to be worse as well.
I think I see pizza in those commercials.
Oh yeah, definitely.
So that would be like the heavy carb, spicy sauce, cheese.
Yeah, cheese has fat and
processed
protein.
meat.
Mm-hmm.
Right,
processed
okay.
meat, exactly.
Okay.
So what we tend to do, or what we see, is that people are blocking acid release. Now we know that in treating infections and many other things, that you want to have B12 absorption, you want to have acid release. It's important for many, many things. What they're finding is that when people take these proton pump inhibitors for a long time, they have an increased risk of bone fractures.
Oh no.
Increased risk of having low magnesium levels,
Oh.
which can have a huge effect on the body. Increased risk of infections like pneumonia. And then increased risk of chronic kidney disease, which is probably the worst of all because it's very difficult to treat.
Now, why would that be?
The chronic kidney disease?
Yeah.
Well, it's difficult to say, but we think a lot of these things are related to when you don't have acid, you're not killing the microbes that come in.
Mm-hmm.
The acid has a major responsibility in killing those right away. So that could be a portion of it, infectious cause. In terms of the kidneys, it probably has something to do with not breaking down nutrients.
Could it also be that these medications are hard on the kidneys?
Well, yeah, I mean that's for sure. When they make it back into circulation, they're definitely hard on the kidneys. So it's a major issue that's coming up because people are taking these every day.
Yeah, it seems like very popular.
Mm-hmm. Oh yeah, I mean the most popular would probably be having Tums around.
Yeah.
Which
is that
not
the
in
same?
this. It's not in this category. It's
okay.
a different type.
Okay.
But still, along the same mechanisms, there's an underlying cause here that needs to be addressed.
Right. So this should only be taken for like acute things, but then you should solve the actual problem as to why this is happening.
When this comes up for you, you don't want to be in pain. You don't want to be going through this, but you want to then work on getting to the cause.
Right.
So it's a good reminder because, you know, the people have been on these for a long time now, since the 90s, and it's time to make some switches.
So are they going to tell these people?
Well, this is us trying to tell people right now.
Yeah.
I mean, it's being picked up by the news, but not in a major way.
Okay.
Not in a major way. And these things are mentioned on the commercials, just at the very end.
Yeah, there's always footnotes, isn't there?
Right. So, I mean, something to be concerned about. Let's get to the cause. I mean, it brings us back to this, which is something we have been talking about for a long time. You have to get to the root cause of things. It's fine, and I do this. Help people with their symptoms. Get through these symptoms. You don't want to be sitting in pain.
Right. You don't want people to suffer.
No. But we need to start getting to the cause. This next study, very, very interesting, has to do with C-sections.
Okay.
Which is incredibly popular. It's becoming more and more popular, having C-sections done electively. But also, you know, a lot of people have to have C-sections because of complications and that sort of thing. What we've been concerned about in naturopathic medicine is the beneficial flora that's transmitted to the baby.
Right.
We know that babies who are born vaginally get the flora from the mother. And we're talking about probiotics, basically, is what we're going through. So what they're noticing is that in epidemiological studies, they're seeing that there might be an increased chance of immune and metabolic issues with babies who are born by C-section. So this is asthma, allergies, obesity, and type 2 diabetes. There may be a correlation. So they think this is because of the good bacteria not getting to these babies through C-section. So what has been started, and this was just published this morning, but I know it's been done for a while now, is vaginal microbial transfers.
Oh my gosh.
It's being done.
No way.
Yes, and it's being done effectively. So now we're starting to study it. So what they're doing is they're swabbing the mother, and then it takes about 15 seconds once the baby's born, but they transfer the swab to the skin, the lips, the genitals, the anus, inside the mouth, all over the body, really. And what they're seeing is this recent study that I read is they're following up quite quickly, you know, or so I should say periodically, and they're seeing that these babies have proper flora on the outside of the body. They're still waiting to see if it's going to be digestively.
Okay, so why would this work?
Well, because what they want to know is they're trying to teach the body to react properly to microbes.
So the theory is that when you have a baby naturally, it receives certain microbes.
Yes, when it's in the vaginal tract on its way out.
Okay, so then the baby, right there, the immune system is like imprinted.
The immune system learns these are normal. These are the good bacteria. This is what we need. This is what we need to have. And then whereas babies who are born to C-section, we know that they are exposed first to bacteria that's on the walls of the hospital room, what's on the table. That's what they're exposed to, and their immune system already starts to realize, oh, this isn't normal. So what we're trying to do is get this good bacteria in there as quickly as possible. And women are requesting this, and this is even outside of the study, women have been requesting this for a while.
No way.
Definitely.
I mean, I guess it makes sense if this is the theory.
Well, and now we know about all these probiotic studies being so beneficial for childhood asthma, childhood allergies.
Did it say where this is being done?
It may have. I'm not sure. But it's being done in hospitals all over the place.
Wow.
Yeah, and you can request it now, and it's not a big deal.
That is
very interesting.
Very interesting.
So vaginal microbial transfers.
Yeah.
I mean, it's we have to do something to, because now we're learning so much about the immune system, and we have to do something to treat allergies, asthma, and atopic dermatitis or rashes in kids, because it's just becoming the population is just growing and growing and growing. The number of kids who are either allergic to peanuts or allergic to gluten or have asthma. Or,
yeah, I suppose.
Mm-hmm.
Huh. Well, that is really interesting.
Yeah, it's very interesting. We have one more thing to talk about today, and this might be too much of a topic to go through, but it's gene editing. And this is highly controversial, but I have to bring it up because the researchers in the UK got this approved this morning, to edit genes in human embryos.
Oh my goodness.
And I'd like to get what you think of this. So I'll be upfront. They're not going to be then transplanting into mothers' wombs. So these embryos will not be becoming children. This is just for a research possibility. So we know that there's something called CRISPR, which is really, really good at editing genes, and it could be useful in...
Wait a second, I just have to stop you. So where did the embryos come from? And who's giving embryos that...
What?
So this is human trials.
It is. It's human trials, yes.
How is that passed?
Well, there's an agreement that they won't be developed into infants. Yeah, interesting. I know.
That's shocking.
It is shocking. So this is not being done anywhere except in the UK, and it's basically just one researcher who's leading the team.
So what are they going to do?
They're going to see about how this CRISPR mechanism of editing genes can be helpful in reducing the amount of genetic disease.
Oh, I don't know.
So this is a very, very interesting start, and can be scary depending on how you look at it.
Mm-hmm.
Because we know that this mechanism called CRISPR, which we've talked about a little bit, but not on the show yet, it's very, very good at editing genes for things. So you can basically turn a gene on or off.
Wow.
And they've been able to do it in mice, and we know a lot about how what fetus development is like in mice because we've been able to test it, but we don't know about how the genetic mechanisms are played out in fetal development in humans, and this is the first trial of its kind.
Well, this is really manipulating nature.
It is manipulating nature, 100%.
Wow.
So we'll see what the media thinks of it, and we'll see what scientists think of it.
There's going to be a huge backlash.
Mm-hmm. So of our time right now, the most controversial things in sort of human evolution would be this CRISPR mechanism of gene editing and artificial intelligence.
Okay, but tell me, so say they figure this out.
Mm-hmm.
What's the plan?
Well, the plan would be, say a couple is having a difficulty having a baby.
Okay.
There's genetic disease in their family.
Okay.
Okay. I don't know what diseases, but it could be any genetic disease.
Okay.
So they go in for IVF.
Mm-hmm.
They provide the sperm and the egg. They then it's formed into an embryo. They do gene splicing. They turn off the genes that we know are for genetic disease.
Oh my gosh.
And then they do their IVF afterwards.
Well.
And this research will allow us to know what will happen afterwards.
Ugh.
Because we know that a lot of genes do a lot of things. It's not like one gene
But
does one thing.
how long afterwards? That's what I don't understand. If these are not going to turn into children, we're still not going to know what the ramifications could be. We only will know how the embryo would be altered. Like, what if, there was huge behavioral, mental, emotional...
Huge. What else do these genes do? We know that genes do many things. Genes aren't just one gene, one attribute, one gene, one phenotype. We don't know. They do many things. And you're right. There's going to be mental, emotional ramifications.
I'm shocked that they're letting this happen.
And they're going to be. This will all be in an incubator type situation where it's replicating a womb. How is the placenta developed? How is this done? How is this? And if we change the genes, how does that affect? But we're not going to know what the long-term ramifications are. There's really no way.
Wow.
Now, I'm not an expert on this.
No.
But I find it very interesting and controversial, and I think it's important for people to know that this is happening.
Definitely.
Wow.
We'll see what happens in the next couple of weeks.
Yeah. Absolutely. I mean, it was just published this morning, and already it's been picked up in the United States by most news sources, and everyone's talking about it.
I can imagine.
Anyhow, very, very interesting. That's Healthy Rebel Radio, episode 20. Thanks for listening, and have a great day.
See you.
Healthy Rebel Radio is presented by the online health and wellness center, DamiHealth.com. Since 2009, Amy Lane has successfully coached thousands of women through her signature program, the Bikini Body Program. Join today to work exclusively with Amy to unveil your greatest yet to be from the inside out. Go to DamiHealth.com for more information.
Thank you for listening to Healthy Rebel Radio. Please connect with us on our community pages on Facebook, Pinterest, and Instagram, all at the handle @DamiHealth. For weekly recipes, articles, and all our episodes straight to your inbox, join our newsletter at DamiHealth.com. You can find all the links discussed in today's episode in the show notes. Thank you for joining us, and see you tomorrow.